and welcome to Your Health. Folks, we have something for you that all of you are interested in, and we have the top infectious disease doctor in our area to talk to you about COVID. There are so many questions, and we are thrilled to have Dr. Wick Many, and you are an infectious disease specialist. You are not some other specialist. You are the one who studies this and knows what you're talking about. Right. So there are just myriad questions out there, and I would like, would you just address what we're facing with COVID?
Sure. Well, first, thanks for having me, and I appreciate that lovely introduction. It's probably way over the top, but I'll take it. Well, as we were just speaking before we started, just to put COVID in perspective, in the 4 years roughly of World War II, about 6,000 men and women from Alabama died or were killed during World War II. Since February of 2020, roughly 2.5 years, 20,000 people in Alabama have died from COVID. So for those who think that this is fake news or is not something that's actually happening, it's real. It's very real. It's very real to the people who developed the illness, to their families, to their friends. It's also very, very real to the healthcare workers who are struggling with emotional strain and burnout. So, for whatever sake, this is a real problem. I know there's a lot of misinformation. Unfortunately, politics got in the way of public health and science. And I think a lot of that started with misinformation from our political leaders that was inaccurate and was somewhat divisive. So.
Well, we're facing, we've been through the COVID-19, the original, and then now what seems to be sweeping is those subvariants.
Right.
Tell us what we need to do to keep ourselves as safe as we can, and if we get it, what we need to do.
So the question always comes up is, why are there all these new variants of COVID? Well, COVID is an RNA virus. Okay, there are two kinds of viruses. There's a DNA virus, in other words, a virus that just has DNA in it, and an RNA virus that just has RNA. And so COVID is an RNA virus. One characteristic of all RNA viruses is that they reproduce themselves extremely rapidly. And every time they reproduce themselves, they make a tiny little genetic mistake. And over time, those mistakes add up, and that's why you get new variants. You get the Delta variant, the Omicron variant, and that's just because the virus is reproducing extremely rapidly, and it still has a pool of susceptible individuals to replicate in. So if we can stop the pool of susceptible individuals, hopefully that will be able to turn off the virus and the pandemic. So the virus causes, the current virus, the current strain is the BA.5. It's extremely infectious to others. It seems like it's not as intense as far as causing illness and death, although if you have underlying conditions such as diabetes or emphysema or severe heart disease and develop COVID, you put yourself in a very high-risk pool. The vaccines that are available are the most studied vaccines in history. The polio vaccine that I received and you received as small children had a small number of people that participated in the trials. This vaccine has been studied in hundreds of millions of patients, and it is safe, it's effective. Sure, you're going to have the small fraction of folks that are going to have an adverse reaction to the vaccine. It's more likely that you're going to get struck by lightning than having a serious adverse reaction to the vaccine. So if you have not been vaccinated, please get out there and get vaccinated. If you have been vaccinated, get your boosters, especially the fourth booster if you're over 50 years old and have significant underlying medical problems.
Okay, so those are the main vulnerable population people, over 50?
Over 50 and any type of underlying medical problems. So diabetes, particularly diabetes, chronic lung disease, severe heart disease. If you're on chemotherapy for whatever reason, whether that be a rheumatological disease or cancer, you're in a high-risk pool. Get your vaccine. In addition, I think it's time to start back wearing masks. If you're in a large social gathering, if you're in a grocery store, if you're at church, I think it is perfectly reasonable to continue wearing masks and try to socially distance as much as possible.
All right, and the next question real quick is, let's say I've done all those things, but I get it. And
Right.
you can, even though you've been
That's exactly
vaccinated
right.
and boosted. What do I do if I get sick? What are the
So
steps
first
I need?
off, there's a misconception that the vaccine was to prevent infection. The vaccine was never intended to prevent infection. The vaccine was intended to prevent illness and death. It does a great job of preventing illness and death. If you have been fully vaccinated and you develop illness, then you need to contact your physician. If you may be qualify for the antiviral drug called Paxlovid. Paxlovid is oral. You take it. It has issues, but it's a very safe drug by and large. But the most important thing is if you get symptoms, get in touch with your family physician, your primary care doctor. The main symptoms that you really need to call about is sustained fever. In other words, not fever of one day, but day and day and day and day of fever. And any lower respiratory complaints. And what I call lower respiratory complaints is shortness of breath or severe chest discomfort. I think those are sort of red flags that you really need to get in touch with somebody about.
Okay, that's absolutely great. And you want to be sure that you take a test.
Take a test.
So be aware of that and follow up if you think that you have that. Don't just sit there. Do something.
Right.
So
right.
thank you so much,
you're more than
Dr.
welcome.
Many. I
Glad to
appreciate you
have-
coming
glad
in
to be
and
here.
taking the time to do that.
Yes, ma'am.
And folks, listen and learn, and thank you for being with us. And we'll be right back.